Hi, I will be describing the role of occupation in the promotion of health and the prevention of disease and disability for an individual with major depression disorder. I will also include and consider the family. The causes of mood disorders, such as depression, is still unknown. For some people, depression is caused by decreased neurotransmitters in the brain. It may have to do with genetics and psychosocial factors such as personal history. However, an argument can be made that although some forms of depression can be traced to a person's life events, the thinking patterns of people with depression affect the brain's ability to produce neurotransmitters. There is a mind-body connection, which might be why some people respond so well to antidepressants that target and elevate neurotransmitters. Archinson and Diretti 2017 report the average age of onset for major depressive disorder is mid to late 20s, but adolescent depression triples for girls after age 13 and carries a higher risk for recurrence of 30 to 50% during early adulthood. Occupational therapy recognizes the importance of habits and routines that promote the adoption and maintenance of healthy behaviors. Healthy behaviors enables the occupational therapy practitioner to facilitate success by matching the person's skills to the demands of the activity. Using environmental supports and minimizing barriers and offering solutions to challenges associated with changing health status, habits, and routines. My niece was diagnosed with major depressive disorder when she was 12 years old following a traumatic event, and she is now 23 years old. The early onset of major depressive disorder has limited her ability to develop educational, social, and work skills. She has periods of social isolation, avolition, anhedonia, altered sleep, depressed mood, and irritability. When her parents notice an unusual recurring depressed mood, the primary cause is medication non-compliance. As a family member, support, patience, communication, and understanding are key. My sister being observant and noticing those off days and talking to my niece on the importance of health management and maintenance is vital for her independence in IADLs. Her mom can help her set up a visual board with a medication schedule and set up a daily alarm to minimize or prevent forgetfulness. When my niece comes over and visits for a few days, I make sure she does not stay in her room after she has woken up, and I give her small chores around the house to keep busy. I encourage and include her during meal preparation, calling her my sous chef. A person dealing with major depressive disorder needs assistance, but so does the family. A helpful tip is having a support system. Support systems can be other family members, friends, case managers, and support groups. There is a great support group following through social media like Facebook. An occupational therapist working with a client with depression may teach coping skills in self-soothing, distraction, opposing action, emotional awareness, mindfulness, and building a crisis plan. The occupational therapist can provide information to mentorship through local behavioral health services. NAMI, or National Alliance of Mental Illness, provides educational programs, advocacy, helplines, and awareness events. NAMI is national, however, they can aid in finding local resources to assist every individual better. If you would like more information, you can go to NAMI.org or call 1-800-950-6264. Occupational therapy practitioners can help persons with depression examine how to balance leisure, work, and relationships. We look at the daily structure and include certain occupations and strategies to ensure that clients follow through on things to meet the responsibilities of the roles that are meaningful to them. Intervention is specific to each client's needs, challenges, and strengths, so please treat this video as an informative video, not a treatment. If you or someone you know is having difficulty with depression, you can call National Suicide Prevention Lifeline at 1-800-273-8255.